Hi, I'm Robin Czajka. I am the Vice President of Cost Management at Premier. I'm a nurse by background, and my area of expertise is in the value analysis process and developing a clinically integrated supply chain.
Thank you for joining us, Robin. As supply chain evolves through clinical integration, what is the role of communication with clinicians and physicians?
Physicians and clinicians are integral to the process. In fact, most of the very successful supply chains that we work with are owned by physician input. So they drive the value analysis process. Usually we'll see a well-developed front-end value analysis process where there's plenty of communication about the devices being considered. But at the end of the process, we don't have that feedback loop. So it looks more like a chain. What you need is a feedback loop so that if the physicians make the determination that this new device at a great price is not impacting outcomes in a positive way or has some negative impact on quality, they might simply stop using the device, and then the supply chain doesn't understand that, so they can go in and support that change. So it's very important that we have integration across all of the areas of the clinical space within the hospital and supply chain. In the end, nobody can sit on the bench. This goes across the entire organization.
As supply chain meets with clinicians and physicians, how should data be utilized?
Data is the most important thing to informing a clinically integrated supply chain. And really, it's the turning of data into usable, digestible information. So if a physician says, great, that acquisition cost is great, and walks away and doesn't tell you that they really don't feel that this is going to be something that they want to use, you can only further that conversation if you go in and say, hey, I have data on the outcomes. There's no difference in the outcomes between this preferred widget and this widget that we've negotiated a wonderful price on. And to look at that. Physicians, nurses are scientists by nature. So if you have validated and well-defined cost, quality, and outcome data that it also has some valid comparative benchmarks, they'll respond to that.
Great. What are good sources for data?
Well, you can access your own ERP, your MMIS system, any of your clinical documentation systems, as well as your OR log. And a lot of people partner with their GPO to get data from their GPO. Most GPOs have some kind of supply line benchmarking. You can also get operational benchmarks as well as quality benchmarks. And then there are other places that you can look in the marketplace for data repositories that'll offer some comparative benchmarking.
Can you discuss a patient's journey outside of the hospital as it relates to the clinically integrated supply chain?
So typically, we've approached the acute care space in a vacuum. But now part of the outcomes piece of how we're going to approach this is we have to look at every care setting that patient's going to encounter on their journey to wellness. And so if they, for example, get a hip done, what is the durable medical equipment that's going to fit into those care settings? If they have a house with stairs, are we anticipating how we're going to get them into their house? Who's going to help them set up their medications if we're going to give them complex post-operative medications? All of those things need to be incorporated. Ultimately, you can have the physicians, the nurses, and the supply chain sitting around the table, integrating and making those decisions. But if at the center of all of that, the patient doesn't sit, we're never going to get those decisions correct.
Great. Thanks, Robin. We appreciate your input today. For more education like this, visit the AHRMM Learning Center.